Welcome everybody to our Grand Rounds presentation today. Good to virtually see you all. I have the pleasure today of introducing our speaker, Dr. Marjorie Rallins, and her team who will be with her. I'm just going to say a few words about Marjorie for those who may not be as familiar. And I know we've had the opportunity already to introduce Marjorie more broadly to the Institute, but not everybody may know a bit about her background. So Dr. Rallins joined us at the beginning of this year as our executive director for LOINC, and we're very honored and pleased to have her here, and you'll understand why as you hear her speak and hear more from the LOINC team about all the great work that's going on. But just a little bit about her background. She comes to us most recently from the PCPI Foundation in Chicago, where she was vice president and chief scientific officer. She started with PCPI when it was a program of the American Medical Association, and as the vice president and scientific officer at PCPI, Dr. Rallins led scientific programming and fiscal and operational management. And as a member organization, PCPI focused on improving health outcomes through advancement in performance measurement, clinical registries, clinical quality initiatives. She contributed to positioning PCPI as a standalone entity and had been employed in some capacity with AMA and PCPI since 2005. Also has an extensive history in the standards space, and I'm sure we'll hear a bit more about that, or we can certainly talk more about that with her during the Q&A. She got her undergraduate degree from Townsend University and her degree in podiatric medicine from the William Scholl College of Podiatric Medicine. She was chief resident at Southwest Detroit Hospital and completed her Master of Science degree at Northwestern University and practiced as a podiatrist before working as the director of clinical editors for the College of American Pathologists and continuing her career up until this point in the health informatics and standards space. So really, really happy to have her on the team and here today to talk a bit more about LOINC along with the rest of the LOINC team. So with that, I will hand it over to Marjorie.
All right, thank you so much for that kind introduction, Peter, and hello everyone. I guess I should share my screen. That would be important here. And so that. Okay, so again, it's a pleasure to be here today and for today's session of Grand Rounds and talk to you about LOINC. We want to share some historic perspectives and give you a snapshot of some things we're working on now, and also talk about the next frontier or horizon for LOINC. Today's presentation will have a different format than what is typical for Grand Rounds, and I'll talk to you about that in a minute. The learning objectives align with what I just described, and by the end of today's talk, you should be able to describe the history of LOINC, explain its role in the standards realm, and summarize our current activities and explain LOINC's future goals. Joining me today as co-presenters are my LOINC colleagues, Dr. David Baorto, content terminology developer, and John Hook, who is our software development manager, and Jami Deckard, who is also a content terminology developer, and April Lackey, who is our program manager. Our presentation today is intended to be informative, illuminating, and interactive, and it's in three parts. So David and I will begin and provide some background and context and talk about LOINC's history and connection to Regenstrief, its relevance and impact on healthcare, and also discuss some specific work that we are doing now. Additionally, we'll share a little bit about our vision on what we see as the next frontier and horizon for LOINC. As you know, with any organization or program within an organization like Regenstrief and LOINC respectively, having a focus on next steps is critically important for remaining responsive and on trend in serving the community and other stakeholders. Up next will be Jami and John, who will share some illuminating information about LOINC. We know that as our Regenstrief colleagues, many of you are familiar with the data standards realm where LOINC sits and have an appreciation for LOINC's role in healthcare. And some of you may be less familiar. Regardless of your perspective, there's always something new and enlightening to learn about LOINC, and that's true for the LOINC team as well. We learn something new about the terminology that we steward. And we do that every day. So Jami and John will share potentially new and hopefully enlightening and useful nuggets of information about LOINC that you can take with you. And they'll share that in a top 10 list, kind of David Letterman style. And then we thought it would be great to continue sharing that information or reiterating that information that we just shared in an interactive way. In April, will lead us through that section. A little bit of background and history about LOINC, also known by its long name as Logical Observations, Identifiers, Names, and Codes. It's recognized as the global standard for identifying health measurements, observations, and documents. LOINC was established in 1994 by a then Regenstrief investigator who some of you may know, Dr. Clem McDonald, out of a need for a universal language for observations for electronic data exchange so that laboratories and other entities could communicate orders and results to hospitals and provider and physician officers and payers, et cetera, who use the data for clinical care and care management purposes. I'll say that LOINC has grown in scope and content since its inception. In 1994, the initial focus was on laboratory observations. Clinical observations came along in 1996, and today it includes both laboratory and clinical concepts that are used when someone orders or needs results for health measurements and observations. And we also have concepts that are used in clinical documents and surveys. LOINC is maintained by a very dedicated team here at Regenstrief, for which there are 13 members. And we get support, of course, from Regenstrief. And we also get funding through federal and private grants and contracts. So as I mentioned earlier, LOINC is a data standard, and I'd like to talk about drivers in healthcare that have influenced the increase in demand for data standards, because having that context will help set the stage for describing the work we're doing now and what we see on the horizon for ourselves. Drivers for the adoption of data standards like LOINC include the transition of the healthcare system from paper to electronic health records, coupled with a heightened focus on value-based care, meaning a focus on payment for health outcomes and quality versus a focus on payment for volume of services provided, which has been customary in the past. So together, EHRs and value-based care have a significant impact on the way we as a health community practice and deliver care, conduct research, do public health surveillance, et cetera. And there's an expectation that clinical data will be shared across medical centers, public health institutions, disease registries, what have you, to improve patient care, health outcomes, research, surveillance, et cetera. And achieving these goals requires the exchange of complex information and data that is standardized without errors or loss of meaning across a wide spectrum of healthcare systems that are often disparate and not connected. Data standards like LOINC make this happen and makes healthcare data more portable, computable, and understandable. And all of these drivers have influenced and guided our work today. So looking at our work, in December 2020, we released LOINC version 2.69, which has almost 95,000 codes in total. And as you can see here, most of the December release is comprised of LOINC codes for laboratory observations. A little over a quarter is for clinical observations, and the rest was for surveys and documents. Most of our work is US-based, as you can see here on the right side of the slide, and we collaborate very heavily with federal agencies who also fund a good portion of our efforts. And we sometimes join forces with organizations from the private sector and work with international organizations as well. So shortly, I'll turn things over to David to talk more specifically about some of those projects. What's also important to note about our work are the users of LOINC. The reference labs, the healthcare providers, the federal agencies, the payers, device manufacturers, researchers, and others who use LOINC and other standards to move data seamlessly amongst and between systems. So LOINC has a widespread adoption around the world and is the official national standard in a number of countries and is translated into a number of languages. And while there is international adoption, we do not have the same penetration internationally with respect to how we interact with and support our international users as we do here at home in the US. So we see the international space as the next frontier for LOINC. Lately, we've received a number of inquiries from the international community for guidance and help with understanding and implementing LOINC. We envision this as an opportunity to further promote the use of LOINC abroad, but also as a sustaining opportunity for LOINC and Regenstrief together, which we believe is a win-win situation. And speaking of sustaining opportunities, we see some potential horizons and a new frontier for LOINC. There's been a heightened focus and incredible growth in new and evolving technologies like AI, big data, and telehealth. Some of it is brought on by the pandemic, as we all know, but also attributed to the tech giants like Amazon, Google, and Apple, who have made some striking moves in advancing healthcare interoperability. And that's a space where data standards like LOINC play a key role and is an area where we plan to explore in the near future. And finally, before I turn things over to David, there's another area of pursuit for us, and that is Regenstrief. And while we know that there's some things that we have already worked on together and that there's a perception that LOINC's focus is niche and unique, we firmly believe there are other broader opportunities for LOINC and other programs within Regenstrief to work together. And we believe doing so would be a positive development for Regenstrief as a whole. So some exploratory discussions have already transpired, and we'll keep you up to date as developments unfold. And with that, I'll turn things over to Dr. David Baorto, who will share more details about the projects that we are working on now. I'll stop sharing. And David, I'll turn it over to you.
Okay, thank you, Marjorie. Thank you, everyone. It's really a pleasure to be here, and I appreciate having this opportunity to present to you today. So I am going to focus on some special project highlights, just a couple of projects that LOINC is involved in among the, many activities that we have. Now, just to give a sense of our day-to-day activities in maintaining a standard, we have a whole process in place for taking requests from submitters. And as Marjorie mentioned, all the users of LOINC that we interact with day to day, the committees that help us make decisions about new terms, we have many interactions day to day. And when we receive requests to create new terms, which happens daily, there's a lot that goes into that. There's research, there's interactions, there's questions out to labs, to committees, and each term that we create in LOINC has to be planned in such a way that it's the most useful to the LOINC community at large, which, as you've seen from Marjorie's presentation, includes a full international set of users. So that maintaining the content is critical to us, but some areas where we have somewhat less control or less feelers into are implementation on one side, how things get mapped to LOINC out there in the world. How do local places, local hospitals, laboratories actually perform their mapping process? How is that done in an accurate way? And then on the other side of the coin, once LOINC is mapped accurately, how do you make the best use of those mappings? How do you understand the relationship between LOINC terms in a way that helps you make use of the data, create groupings and aggregations of things that you need to do for all kinds of use cases that we're going to cover briefly. So what I'm going to do today is just in maybe 10 or 15 minutes, give you like a 30,000-foot view of two collaborative projects, one on the implementation side and one on the integration side that the LOINC team is involved in. Hopefully we can get some thoughts and input from the Regenstrief community at large would be great. So the first highlight project related to implementation I'm going to speak about is the SHIELD effort. Now, SHIELD stands for Systemic Harmonization and Interoperability Enhancement for Laboratory Data. It emerged about 5 years ago from a multi-agency workshop at the federal government level, which included the FDA, CDC, and other organizations, and quickly grew to include immediately LOINC, in vitro diagnostic manufacturers. Then the SHIELD mantra was describe the same test the same way every time. And SHIELD's mission is basically, as it says here, cross-institutional laboratory data interoperability by developing a publicly available infrastructure to improve the quality, interoperability, and portability of laboratory data. So SHIELD has, been plugging along for 5 years. One thing I would like to jump to next is actually a memorial. I really can't speak further about SHIELD without giving mention to Mike Waters of the FDA, who passed away in September this past year, 2020, in the midst of working intensely on the testing and devices related to the COVID-19 pandemic. Mike basically was the originator of SHIELD. He conceived of and he led the SHIELD effort right up until his passing. I was in a meeting with him on a Friday, and then he passed on Sunday. So he worked up until the last minute. He was a huge supporter of LOINC as being an important part of the solution for laboratory interoperability. And for years, he attended LOINC meetings at Regenstrief. So I really needed to give him a moment and pay him some attention during this talk. So SHIELD, just to focus on some of SHIELD's accomplishments, and particularly focusing on some of the COVID-19 work that SHIELD has done. Well, from the beginning, SHIELD adopted and promulgated a specification known as LIVID, which basically outlined an industry-defined format to publish and exchange LOINC codes for vendor in vitro diagnostic test results. So the idea is that by moving the coding upstream to the test manufacturer, you automatically obtain a level of interoperability that you couldn't obtain by individuals of variable expertise doing their own coding. So it was basically a way for IVD manufacturers to say what the LOINC code should be. Then collaboratively, SHIELD has since enhanced delivered standard to also include SNOMED CT codes for qualitative result values. The idea being LOINC is the question, SNOMED is the answer. That's kind of the way it's been passed on for a few years now, as describing the boundary between LOINC and SNOMED. LOINC, SHIELD also supports other standards as well. Obviously, the LIVID specification, UDI codes for instrument identification, the FIRE standard, UCOM unit standards. Now, in the beginning of the pandemic, and since the very start of the pandemic, an offshoot of SHIELD is a group that meets weekly to review the emergency use authorizations that have been submitted to the FDA for that week for approval, and discuss the coding, both LOINC and SNOMED coding, that covers that specific test kit. This has been going on weekly. I've been in those meetings along with other members of the LOINC team, Tracy, Swapna, and Rita also have joined that meeting as well. And it's been I think it's been a real boon for SHIELD, and it's helped us create a formula for providing LOINC coding at the in vitro diagnostic level out to the community at large. And in fact, this results in the weekly publication of a file on the CDC website. We won't go to it now in the interest of time, but which provides LOINC codes for the orders and the results of each of the SARS-CoV-2 tests, and SNOMED codes for the answers and the specimens are within that file as well. The file currently has over 700, I believe, rows, which represent, at this point, probably over 400 distinct assays related to SARS-CoV-2. So where is SHIELD going? Since Mike's passing, it really feels as if SHIELD has been energized. We feel like we want to take what we've done during the pandemic and expand it on an industrial scale to do this for all lab testing. So SHIELD has initiated now a strategic plan. I've listed some of the committees that are part of the strategic plan currently. And I'm the LOINC representative and Regenstrief representative to the SHIELD committee, and we've been appointed as chair of the effectiveness committee for monitoring and evaluation of the effect of the SHIELD effort on the coding and accuracy of coding of laboratory data. So our goal is to develop evaluation plans, data collection, knowledge to support evidence-based decision-making related to the SHIELD effort. And I'd like anyone at Regenstrief who has any experience in monitoring and evaluation, please reach out to me, and if you have any interest in participating in this effectiveness committee to measure the effect on coding, that would be great. Okay, now just to jump to a second project, and I'm just checking the time quickly. The second project I'd like to highlight on the integration side is related to the idea of, once you have LOINC mapped, how do you answer questions about the relationship between LOINC terms? Just to give a few examples. Say you want a list of all the patients who've had a test done for an antidepressant in urine, for example, or you want a list of all cardiology notes that are authored by attending physicians to display in a chart, or you want to know all the glucose tests that a patient has had. These are the kinds of questions that are on the integration side. And once you have LOINC mapped, you still need to be able to compute between LOINC terms to understand what LOINC terms are similar, how they're similar, how they're different. And a way to do that would help you answer these types of questions. So what's been done is the LOINC team at Regenstrief and Chris Schutt's group at Johns Hopkins University have submitted for an R01 entitled Computational LOINC to Support Biomedical Research at Scale. We've spoken to Chris recently, and he reports that we've actually been awarded this, and he's got verbal confirmation, but we have yet to have a formal notification of that, so we are still awaiting that. I'd like to review kind of the aims of this grant and where we hope to go with it. So the 4 aims are listed here. One is to render LOINC in OWL to support reasoning. If you don't know what OWL is, it's the web ontology language, which is a way of organizing information and knowledge to allow reasoning and computation about it. And we'll see some examples in a minute to help clarify that a little bit more. The second aim is to link LOINC components to open standard ontologies. I have to explain that a little bit more, but this is a way that we're hoping to bring outside knowledge to help LOINC leverage outside knowledge about concepts that LOINC uses. And we'll, as I said, we'll see that in a minute also. The third aim is to demonstrate LOINC use cases. You know, all tests detecting antidepressants in a patient, for example, as I said before, we're going to see that example in the ontology. And finally, to engage the LOINC user community and really to find out what is the best way to provide sort of a semantic representation of LOINC to the community. What would be the most useful? And that's what we're hoping to do with this grant. So work that we've done to date is currently we've taken a piece of LOINC, the document ontology part of LOINC, where LOINC codes documents and then maps them to different aspects of a document, such as the subject matter, the role of the person who entered the document, the setting of the document. Not going to explain that in greater detail today, but we've actually produced an OWL file, which represents the full document ontology along with all the LOINC terms that are within that ontology, and that's now published with each release. It's was active as of the 2 LOINC releases ago. And that's kind of our pilot for this grant. The second project that we've been working on are LOINC component part maps. And I think before I talk about these mappings that we've already done from LOINC to external knowledge, I want to just give you a brief 30-second view of what a LOINC what makes up a LOINC term. So here you have a LOINC term 17856-6, which represents hemoglobin A1C ratio to hemoglobin in blood by HPLC. That's the method. So this LOINC term actually is made up of little pieces that are assembled together to build the meaning of this term. And each of these pieces actually is a coded entity in and of itself. And these pieces are what are linking out to external ontologies in order to place all the LOINC terms that use those pieces in context. And thereby, I'm going to add this comment, all the local codes map to this LOINC term in the context, potentially, of that external ontology. So that's kind of where we want to go. So every LOINC term has a component, and it also has the component, if it has parts like a ratio, can be broken up into further coded components of the numerator and denominator, and other things as well. So just to show you that a LOINC term is not just a name or a list of or flat string, it's basically a conceptualized entity of built parts. So now I can go back to the previous slide, and tell you that we've already done mapping of all the microorganism components in LOINC to the NCBI taxonomy. We've mapped chemicals and drugs to the KEBI ontology, which is maintained by the European Bioinformatics Institute. We've mapped genes to NCBI genes and variants to ClinVar. Allergens, we've mapped cells to OVO. We've got mappings as well to SNOMED, ArcSNORM, and PubChem. Let's get through these quickly. And then these are just some counts of some of the mappings we have, but we'll just pass over that. Here is a diagram, which is one of too big for its quality, but it's from the grant. This basically demonstrates what our thinking is about how LOINC can be helped by connecting to external things like the NCBI taxonomy. For example, here's a LOINC term for Acinetobacter baumannii DNA presence in a positive blood growth by PCR. Basically, that's what this LOINC term represents, 93406-7. So this LOINC term has a component, like I just showed you, part, which is a coded part, Acinetobacter baumannii, which then links out to NCBI taxonomy ID 470, which then this LOINC term can take on the semantics of being a member of the NCBI taxonomy. So it sort of picks up that information. You can also link out to the page from LOINC term to show further information and resources. LOINC code, amitriptyline plus nortriptyline, mass concentration in urine, similarly has parts amitriptyline, nortriptyline, which can be mapped out to their KEBI concepts, which then places those in the context of the KEBI ontology, which this is a structural part of the KEBI ontology, also has a role part for a clinical role of that chemical. So where are we going here with time? I think we're still good. I'm going to quickly jump out just to show you, because I think it's worth seeing what an ontology OWL file actually looks like.
David, you're good. This is Marjorie. You're
Yes.
good to do that. Okay.
Okay.
Yeah.
Thanks, Marjorie. So this is a program, an application called Protege. And if you're not familiar with Protege, it's basically a free software from Stanford that's a way of opening an OWL file and showing ontological information that you've modeled. So this is our document ontology.owl file. It's got a header page, and if you go to entities, you can see you can drill down into the ontology. This documents have a subject matter, kind of document, a role, setting. You could further drill down into each one. I have sticky notes on my screen, so I can't see where I am, but there we go. Internal medicine, cardiovascular disease. So you can see the ontology from the LOINC document ontology on the left, and if you click on any of these, you can highlight here, and you can see the LOINC terms that make use of that part. So it's kind of a way of organizing, and these are the individual LOINC terms, a fully specified LOINC, clinical cardiac electrophysiology consult note has the subject matter, clinical cardiac electrophysiology. So it links to each of these, and similar for the kind of document, it's a note, subject matter, we just did, type of service, so basically you can see how it organizes the notes. And what I want to show you, going back to the presentation, is an example where we can also run a query. So if you can focus on cardiovascular disease, and you can see attending in this the hierarchy of LOINC parts on the left, you can see on the right, you can run a query asking you for all documents with cardiovascular disease and the role of attending. And so you can get a list of all the cardiology attending notes. Similarly, if you look at the NCBI taxonomy of microorganisms, that's what you see on the left. What you see on the left is from NCBI, what you see on the right are the LOINC terms. And what you see is by querying for Legionella, you can select that you can get all the LOINC terms that measure Legionella on any specimen, or you can further say, I want to only see serum, or I want to see CSF. So it's a way of organizing LOINC terms, aggregating LOINC terms, and querying specifically for LOINC terms you want based on an external ontology or an internal ontology, or pretty much any ontology that you link to and build into your model. And here's just an example with KEBI, with the antidepressants, as I showed before. KEBI role, part of the ontologies on the left, and on the right you see a query for LOINC terms with a component of antidepressant. So once you model ontologically, not only can you ask questions based on parts and single individual concepts in an external ontology, but LOINC codes themselves within the model actually can be, you can infer an interrelationship and a hierarchy of the LOINC terms themselves. So here's just an example of that. You can see that these are individual LOINC codes for internal medicine note, cardiology note. So these notes are actually falling into a hierarchy based on the 5 hierarchies of all the components that they're linked to. And these are the kinds of things you can do. So clinical use cases for this. Why do we want to do any of this? Why do we care? And sorry, Marjorie, I stole your banner from your slide because I wanted to highlight the word computable. And that's exactly what we're trying to do. Standards make health data more portable, computable, understandable. And we're trying to broach this computable area a little bit. And these are the three impacts that Marjorie's slide talked about as, following the transition from paper records to EHR and value-based care, the impact on practice and delivery, and dashboards. I wanted to mention dashboards because dashboards are a way of collecting similar kinds of data. And a dashboard, you can have many different LOINC codes represented in the dashboard, but those LOINC codes could all be related in an ontological way to help you collect that data. Another example here, I just wrote in, show me all the CMV serology tests on CSF for this patient. So if practice and delivery of care might be further helped beyond just coding to a single LOINC term, but by being able to compute on those LOINC terms. And that's kind of what we're trying to get into. I just want to mention also that, remember, we're not just collecting, when we're talking about answering these kinds of questions, we're not really asking about creating aggregations of LOINC terms. We are, but that's an intermediate step. We're really talking about creating aggregations of patient data that happen to be mapped to LOINC terms. So, you require that correct mapping first. The second example, the second impact, conducting research. Say you want to include all patients who've had, here's our favorite example, antidepressant assay performed, or performing surveillance. Show me all the locations where a patient has had a positive Legionella test. You need just not a single LOINC code, but you need to be able to collect all the Legionella LOINC codes for that, and all the correct mappings. So clinical use cases, that was the third aim. Fourth aim, engaging user community. I think this is probably the most challenging, but the most important part. LOINC has some experience quite a bit of experience actually engaging the user community. We do quite a bit of that, but I think finding out how this kind of information could help LOINC users the best is going to be really tricky. And the reason for that is that every user has their own use cases and may need different aggregations. So do we provide OWL files? Who can use an OWL file? How many LOINC users are going to know what to do with an OWL file? So I think we have a lot of challenges on the user engagement part, but I think providing this kind of information, or at least the tools to be able to approach LOINC in this way, I think is going to be important, and I'm excited to be working on it. And as we said in the Shield slide, if anyone at Regenstrief is interested in helping us in this evaluation, or particularly in this project of looking at the ontology, and can it help anyone here in their research and to help us evaluate the impact of ontological LOINC on the use of LOINC, please reach out to us. I put my email here, but any of us on the LOINC team are reachable. So please do. So that's the end of my talk, and I think the more fun part is to come. So I better close out and let that happen. So thank you all. Bye.
So I think
I forgot to introduce my next people, so allow me to do that. I'm sorry. So Jami, Deckard, and John Hook will now take the role of presenting a fun interactive session. Thank you.
Great, thank you, David. That was very interesting. Yeah, so as Marjorie mentioned, John and I are going to present the top 10 did you know questions, David Letterman style, since just like LOINC, David Letterman too was born and raised in Indiana.
All right, number 10. What is the scope of LOINC? The overall scope of LOINC is anything you can test, measure, or observe. We generally divide it into two major categories, lab and clinical. The laboratory portion covers anything that you can test or measure or observe about a specimen. And the clinical is pretty much everything else except lab. That includes things like vital signs, radiology studies, clinical documents, survey assessments, and other clinical observations.
Number 9, how many countries use LOINC? LOINC has more than 115,000 users currently in over 180 countries.
Number 8, is LOINC translated into different languages? We develop LOINC in English, but we have a great cadre of translators who voluntarily have translated LOINC into 16 different languages. You can see them listed here. We're also currently working with people from the Ukraine and Poland, so hopefully we'll be having 2 more translations coming soon.
Number 7, how can I find out the meaning of a LOINC term? There are several ways depending on the user's preference. You can append the LOINC number to loinc.org/, and you can actually do the same thing for any part number, answer list ID, or group number. You can go to our online search LOINC app. The address is listed there. You can Google it just by searching on the LOINC code. You can use our RELMA tool that we've had around for a while by going to loinc.org/RELMA and downloading it. You can download the LOINC table, and the LOINC term should be included in that download file. And then one other way is you can use our LOINC FIRE code system lookup.
Number 6, what is a panel in LOINC? We use the word panel to mean a collector term that contains an enumerated set of discrete child elements. In lab, panels are often called batteries or order sets. An example includes the CBC panel. Most labs primarily have mapped their terms to individual result codes in LOINC. A growing number of labs are mapping their local order codes to LOINC, which could be single tests or panels. Additionally, panels are used to represent full clinical assessments and survey instruments such as the PHQ-9.
Number 5, what are the top 5 search LOINC codes pretty much in the past year, according to Google? And as you would expect, the top 2 are related to SARS-CoV-2 testing for COVID-19. And then the third one is the ratio of the hemoglobin A1C to total hemoglobin. And then the last 2 are related to blood pressure and body weight.
Number 4, does the LOINC team collaborate with other health standards organizations? We play a very active part in the standards world. Here's a short list of some of the SDOs with which we work. This includes HL7, SNOMED, ONC, RSNA, IEEE, IHE, WHO, and DICOM.
Number 3, who's using LOINC for research? LOINC is used in various research projects all over the globe, including some of the following. There's PCORNet, OMOP, Odyssey, Siren, the Monarch Initiative, Health Jump, All of Us, N3C, the HHS Project or Protect, and the COVID-19 Research Database.
Number 2, who's using LOINC at Regenstrief? Here's a short list of some of the recent projects that use LOINC: the Regenstrief COVID dashboard, the MD Clone project, the Precision Health project, the Teamer system, the INPCR database, the notifiable condition detector, the OMOP registries, and there are many, many more.
Number 1, what's with the pig? The unofficial, official mascot of LOINC is our trademark pig. So what's with the pig? When you first read LOINC, you might have wondered how to pronounce it. Actually, it's pretty easy. It rhymes with oink, the sound a pig makes, at least in English. Once the team put this connection together, the pig became the LOINC mascot. There may even be a flying pig at the office. And that's all that we have to share for the top 10.
So I think April is up next.
Yes, and I am going to share my screen, which for some reason is not showing the right thing, but we'll get there. So thank you to David and Jami for that top 10. And also thank you to David and Marjorie for what hopefully is simply a tip of the iceberg of the brilliant work that LOINC does, where they're going, where they've been, and hopefully everybody is coming away with some added knowledge. There we go. Now I have my slideshow up. Okay, so here we go. I get to do the fun part, and hopefully everybody can see my screen now. We are going to do a virtual trivia quiz. And this is just going to test some of the knowledge that you may have already heard and a couple of things that maybe you didn't hear. If anybody has not played a Kahoot quiz, let's see, resume slideshow. This is what we do. Why are we not going? Apologies. There we go. So what you'll need to do is open a second browser screen or check in on your mobile device. I've dropped the link into the chat. It is kahoot.it. And I'm going to also add the code there too. You'll need a specific code, which I've dropped in there. I'll show again in a few moments. And you'll just simply follow the quiz along on your second screen or your device. What will happen is a question will appear. There'll be 4 answer options. You have up to 20 seconds to answer. If everyone is super amazing and answers in that 20 seconds, the question will end automatically. And just to make sure everybody has their sea legs, we'll have a sample question that won't be scored. To win, you get points. Points are based on how quickly you answer. And if you get a streak going in a row, you'll get more points. After every question, they'll reveal the point leaders so we can sort of track that as we go. And at the end, we see who wins. What you win is eternal bragging rights. And just to be fair, no LOINC members are going to play. And if you have any questions about the questions, feel free to drop them in the chat.
April, I'm sorry to interrupt, and maybe it's just me. I think the number you put there is different than the one that was on the screen.
Uh-oh. What number did I put in there?
I think there
Let
was
me show my screen so we can get let me show the, oops. Oh, we already have people in playing.
Oh, there it is.
Hold on, yeah.
9-0 at the end, not 5-0.
Yep, so sorry. Let me see if I can start this over so we can get more people in there. I apologize for that. Oh, well, we do have people in, so we'll just let it go, and that's perfectly fine. The first question was a give me anyway, so hopefully people are in and going. And we have points coming in. If you didn't get the first couple of questions, I can share this as well. 3 major components of LOINC scope. And this was shared earlier. Certainly seeing some more people have joined, and that's great. Okay. Jenny is doing very well. So congratulations, Jenny. This is an important concept. When healthcare data is encoded with LOINC, it is potentially more what? This was repeated a couple of times, so hopefully everybody ignores my typo as well. I'm seeing some new names. That's good. What is a LOINC term made of? David touched on this. I think we might have befuddled a few people. Yes, we did. Straw, twigs, and bricks. Thank you for that one. I'm not sure which is Jen and which is Jenny, but I think there's a Jennifer that might win. We'll see. We have 16 languages, which is not one of them. So as a note, Chinese, Spanish, and German are our top 3. Others include Dutch, French, and Italian to round out the top 6. We don't do Pig Latin. That would be interesting. How many countries is LOINC used in? This was also noted in earlier slides. And yes, for whoever answered 471, there are actually only 195 countries in the world as of today. But if it gets that big, we'll certainly try to reach out. How often do we release LOINC? And if you recall, David sort of mentioned that we do a thorough, a lot of work that goes into every single LOINC term. So they're reviewed, vetted, researched, developed, QA'd, a lot of steps involved. And yep, twice per year. Roughly around 1,200 to 1,400 terms in every release. How many terms are in LOINC as of the latest release? For Eagle Eyes, this was just in a slide I had a couple of questions ago. It was also in previous slides. So if you recall, or if it's very obvious, it might be. Yes, 94,000 terms. Hopefully we'll hit the 100,000 mark very soon. And we're very excited. We're going to mark that with some sort of special recognition. This question was not necessarily presented, but it's certainly an important concept to understand. What happens to LOINC terms that are no longer in use? So we keep them. All LOINC codes exist. They are never deleted, but we certainly discourage further use if they are not appropriate. What is one of the most searched LOINC terms? Obviously, we know COVID SARS codes are very popular this year, but among non-pandemic related codes, what might that be? Yes, systolic blood pressure. Random note, 1-8 acyclovir, it was the first LOINC code ever made, and I love throwing that out there. Shahid is apparently on fire with 7 questions correct in a row. Bonus question, double points. What is the unofficial name of our pig mascot? Again, not something that we presented in our materials today, but just a fun fact. If you know LOINC, you might know it. Back in the early days, this name was informally given and it's sort of stuck ever since. So it's not official, but it is what we call him. It is Lenny. Yes. Okay. Uh-oh. you came up. So here's your last opportunity, another bonus question. This also was not presented earlier, but you get double points if you know when is LOINC Day. Hopefully we get most of the right answers here. And there we go. For all of you who answered February 20th, that is my birthday, so feel free to send me presents. And there's our ranks. Anna R. came in first, Shahid was second, and I missed the third place person, but I will pull that up. So thank you everybody for playing. I hope that that was fun and informative. Sorry, Jenny. Sorry, the last two got you. But we do have just a couple minutes for Q&A. I don't think too many came in, but I will turn it over to, I believe Jenny is handling Q&A.
Or I can take it if you'd like. We only have 2 minutes. If you have questions, I don't think we have a lot of time to talk, but if you have questions, please feel free to reach out to all of us. We hope that you have enjoyed, the presentation, learned something new about LOINC. We are somewhat niche, but really applicable to a lot of work that happens at Regenstrief. We want to, work collaboratively across Regenstrief with all of you to the extent that we can. So again, please feel free to reach out to us on any of the material that you've heard, or if you'd like to work with us on a project, etc.